So my name is Chavi, and I'm part of the CEI team at the NIHR Global Health Research Center for NCDs and Environment Change. And yeah, it's the sort of, I think most of you have joined us for the first session. So this series was created as a space for reflection, learning, and dialogue. I think we can do it better today in a cozy setting. So this is a space where we will collectively explore what meaningful engagement looks like in practice and how we can do it better. This series, as most of you, I think, again, know, is co-created with our public advisory board members whose lived experiences and ground perspectives have help ensure that our work remains relevant, responsive, and rooted in our community realities. So today's session will focus on the theme of empowering community voices and lived experience for lasting change. And I'm really delighted to be joined by two remarkable leaders in this space, Dr. Cristina Parsons Perez. She's the Capacity Development Director at the NCD Alliance, and also the chair for our Public Advisory Board at the NIHR Center. And also with us is Nupur Lalvani. She's the founder of Blue Circle Diabetes Foundation. And today, together, they will explore how communities and lived experience advocates shape policies, challenge inequities, and drive sustainable health outcomes. Their work spans continents, sectors, and disciplines, but I think what unites them both is this deep belief in the power of people to transform systems. And before we dive in, we thought we'd do a little sort of check-in with a mentee poll. Not a poll, a reflection, sort of two questions. So it'd be great if you could, or maybe because this is a small group, maybe people can just speak up any thoughts that you have, whatever you feel comfortable, or type in the chat. Next slide. Thank you, Maruf. So yeah, what we just wanted to know, what do you think empowers community? Feel free to raise your hand, type in the chat here. Perhaps that's the easiest. And again, there are no right or wrong answers, just your reflections and experiences.
Having their voices heard.
Thanks, Neha. Maybe Neha, why don't you add your comment in the Menti as well so that we record it? It seems
Sure.
folks are doing it on Menti. Few themes coming in. Maybe Maruf, we can paste this Menti code in the chat as well for those who are joining later, can continue to add their thoughts. Thank you for Ritu.
Sorry,
Hi,
can I
Ritu.
speak? Or
Yes, of course.
Okay. Hi, everyone. I'm really looking forward to learning from you. Yeah, sorry, I'm like I feel slightly discomfort with the word empowering, the word empower, that we empower. I feel it can be paternalistic because the power already is there within people, and sometimes I've realized that they've forgotten that. And if we can ignite and reveal the capacity which already exists, then people want to take action. And I think that power of here, also power of knowledge, that especially in the field of public health, that health experts have all the knowledge. And sorry I'm being so long, but when people realize their own strengths and each other's strengths, I think that fosters community ownership.
Thank you, Ritu. Always great to hear from you. Really, really important point. And I think, Ritu, Christina, you know Ritu as well from our Public Advisory Board. Her work is really grounded with the communities, and I think that's a really important thought, Ritu. Thanks for sharing. Next slide, please. Maybe we'll move on to the next question. So the next question, somewhat related, is in your work, any reflections on how do you help amplify the community voices? And as Ritu said, it's really the people have the power. It's what role can we play in amplifying? Please feel free to share any thoughts by unmuting yourself here as well. I think a lot of the themes and ideas that have emerged here through these two questions is exactly what Cristina and Nupur will be unpacking today. So maybe so please continue to share thoughts and add comments in the chat as well. It is an open space where we can discuss ideas. So we'll probably push on, and it is my pleasure to introduce our first speaker for today's session, Dr. Cristina Parsons Perez. Cristina is currently the Capacity Development Director for the NCD Alliance, where she's responsible for leading NCDA's work, strengthening both national and regional civil society to drive NCD prevention and control. Cristina has 20 years of health advocacy and capacity development experience, having consulted on advocacy and capacity building, worked at the American Cancer Society's Global Health Department as Director of Cancer Advocacy, and worked at Breakthrough Breast Cancer UK, developing policy and mobilizing grassroots. Cristina represents NCDA as a co-chair of the WHO GCM Lab on Meaningful Engagement of People Living with NCDs and Mental Health Conditions. She's also a member of OECD Paris Patient Advisory Panel, where she brings an organizational perspective in support of lived experiences. And she's also the chair of the Public Advisory Board of our center here. She holds a PhD degree in gene therapy from University College London. Thank you so much, Cristina, for joining today. And without further ado, I'm delighted to hand over to you.
Thank you, Chavi. It's a huge pleasure to be joining you today. So a big thanks to the NIHR Global Health Research Center on NCDs and environmental change, and a big thanks as well to the George Institute. And yes, it's a pleasure joining you today. It's a pleasure to be chairing the Public Advisory Board for the Research Center, and I know that there are some members of the Public Advisory Board joining us today. So it's a real honor to be also learning from you. So we'll get started. On to the next slide, please. But I thought that Menti, onto the next slide, please. That Mentimeter was some of those words were so powerful, and I think we'll be coming back to that. I think what we're wanting to do today is kind of continuing that exchange that we've already started on the role of communities. And we'll have a chance to look specifically at lived experience and lived experience advocates and the role that they play in driving change. And so we're really wanting to spotlight advocacy, what it is, the power of advocacy in achieving systemic change. We'll be discussing some strategies on amplifying community voices and some great contributions just from the Mentimeter just now, and really to kind of spark ideas to those of you that will be joining us today or checking out this recording. And I think when we talk about the role of communities and about advocacy, a lot of this is about power. And so as we started this discussion, there is something really quite profound in the use of language and the feedback that we were hearing, that the word empower is actually already very heavily loaded and implying, that it goes from someone that has power to someone that doesn't have, and that is not the case. We know that communities are extremely powerful, and so hopefully today we'll be discussing how we can be playing a role in enabling communities and looking at that power there. But on to the next slide, please. Just briefly here, I just wanted to flag that I'm working at the NCD Alliance. This is a membership organization. We have over 500 members across the world, and we're really an advocacy organization. And our mission is, uniting this diverse and vibrant civil society to be driving action on NCD prevention and care, leaving no one behind. And as an organization, we absolutely believe that that advocacy is not possible without community engagement. This is absolutely part and parcel of how you lead change. And so that's a circle there on one of our impact goals, which is an in as of itself. We want to be kind of influencing governments to be and decision makers to be engaging communities, but it's also and critically an enabler. It's impossible for us to advance action on prevention, care of NCDs, financing of NCDs without that community engagement. Maybe on to the next slide, and we'll be exploring more how community engagement plays a role in advocacy, kind of creating urgency, demand, and looking for those kind of spaces for participation to be able to be involved in decision making, so that policies, programs, services are designed with are shaped by those they are meant to reach. On to the next slide. I think here what I really wanted to do is just to take a little bit of a chance of it's just a pause moment here to really unpack what we mean by advocacy. I know that we may have some researchers joining us, obviously thinking of the NIHR Global Health Research Center, particularly, and potentially others that can come across this recording. So I wanted to share here a little bit of the NCD Alliance primer, and how what we mean when we talk about advocacy. And so I just wanted to take the chance to share here a little bit about this. There is a practical guide to strategic advocacy planning. We're happy to share the link if you want to learn more. But some key aspects, and what was beautiful about the Mentimeter we did earlier, is that so many of those words are really integral to what advocacy is. We heard earlier about voice, ownership, participation, trust, and rights. So all of this is coming into play here. And so when we talk about advocacy, what we really mean is about seeking systemic change. And so this is all about that, system transformation, and that broad impact for the collective. So we're really looking at, and in practice, what this looks like could be influencing the adoption or strengthening where they already exist. So basically, we're looking to change policy, legislation. It might be that these are funding allocations or programs, services provided. I think one of the key things that we've learned over the years as well in discussing advocacy is, and certainly with discussing advocacy with other civil society organizations working in this space and mobilizing communities, engaging communities, is that advocates organize around solutions. They don't organize around problems. I think that's a key point to be making here. We absolutely have to understand what a problem, what an issue is, but we have to be coming to the table with proposals of solutions, and that's what we can organize and advocate around. Advocacy is essential to be kind of grounded and community-owned driven. As I was saying, that is integral to how we operate as an organization and what we have seen over the years. And the non-communicable disease space has the absolute privilege of learning from previous movements that have gone before us. The HIV movement, the disability movement, the TB movement, just these movements that have shown us that when an issue is grounded and driven by those directly affected, that this is when we can be advancing. Advocacy is a lot about this. It's about power, really, and about sharing power and about finding your power. And as civil society organizations, often our power might not be in the money that we have, but absolutely the power that we do have is that it is the community, the citizenship, and numbers. And so that's another kind of critical area there. So when we're talking about advocacy, there's a lot about collaboration and networks, and who else can we be engaging, or can you be engaging in your issue that you're wanting to advance. I would add one more thing here on the advocacy front, and that is that when we talk about advocacy, so it's obviously about organizing around solutions, but critically, it's also about understanding. So understanding, one, what is it that you want, but another thing is understanding who has the power to give you what you want, and then seeing how they can be influenced. And so just a note here around there is a continuum to advocacy, if you will, and that is that we absolutely need to have awareness in the public and community and decision makers as well. So raising awareness of an issue. Research plays a critical role here in building the evidence, and this may be on how a problem is affecting communities, and it can certainly also be around the solutions and what works. And that evidence base, being data-driven, evidence base, and really kind of understanding how something is affecting the community and what can be done about it, then that brings us to advocacy when we're focusing on pushing for those solutions, and then that can lead us to better policy, legislation, programs, and funding. So I just wanted to leave some of those thoughts here, because I'm sure we're going to be unpacking this as we're looking at the role that communities play. Next slide, please. So there are some fantastic examples of advocacy across the world, and I will share some here. I'm sure we'll be maybe hearing more as we go along, but some examples to share with you briefly here. I mean, they're global examples. The NCD Alliance has been advocating for the recent UN high-level meeting and what was getting agreed there. We advocated for inclusion of NCDs in the Sustainable Development Goal targets. But some examples here at country level, we see NCD alliances. These are coalitions of civil society organizations coming together and advocating on national NCD plans and strategies. We've seen this in India with the national program, including mention there of the importance of meaningful involvement of people living with NCDs. There's some great examples across the world, a couple of examples from the Africa region, in Kenya and in Ghana, where the alliances there were putting forward particular asks across prevention and care at that moment of national planning. We've seen a great deal of advocacy as well around social participation, and that is around demanding those spaces and being involved in decision making. We've seen this in Kenya. There is an intersectoral coordinating committee on NCDs. They played a critical role in the national plan and then in the implementation of the national plan, and the Alliance advocated for this. They play a key role there, co-chairing the committee. There's also lived experience advocates as part of that committee. Some interesting examples of community-led monitoring. An example there coming from Ghana, where the Alliance worked closely with their government and advocated for the inclusion of NCDs in a scorecard. And this is extremely community-driven work. This is where individuals are scoring the service received in throughout the health system. And an example from this is 2 years old now, I think, but it was the Malaysia Health White Paper on healthcare transformation. The Alliance held a whole series of town halls, hearing from the community about their needs and the priority. So again, like really looking into solutions in a particular area of interest around financing and health insurance recommendations, which ended in the Malaysia Health White Paper. So hopefully this gives you some examples and a flavor of advocacy there. Onto the next slide, please. And so just moving quickly now, I think we've already touched upon this with, again, that powerful Mentimeter and some of those key words that were coming through. This is so much about voice. So when we're looking at strengthening the capacity and developing capacity, and we all have capacity that can be developed, right? I think that's a key point, that nobody is starting from zero. There's always capacity there. And so how we can strengthen capacity, this was mentioned earlier, this is a critical one, space and sharing power. So making sure that there are platforms for communities and advocates to take place in. Some examples here in advocacy, how advocates have had the opportunity to be speaking with decision makers and taking a part of those key critical discussions, equipping individuals with the skills to share lived experience in the context of advocacy. And there's something really quite beautiful with the concept of public narrative, and that's around the story of self. That's the lived experience, but then the story of us, that's the story of the community, how there's a collective ownership there, and then the story of now, and that's the specific ask being put forward in advocacy. And a key aspect here is that the capacity of communities is intrinsically linked with the capacity of civil society organizations and an enabling environment for strong civil society organizations to exist. And the NCD Alliance does a lot of work on this, on developing capacity of civil society organizations to advocate, and that includes different things like grants and peer-to-peer connections, and we do that through the Advocacy Institute and the Our Views, Our Voices initiative. We'll keep moving on to the next slide, please. So to amplify community voices, we will be hearing from Nupur Lalvani, who's an incredible advocate, and we can see her there. There was an amazing video that was done spotlighting the incredible work of Nupur. We'll share the link with you, but this is really what it's all about. What we were saying, which is that decision makers aren't going to respond to any demands for change unless it is clearly shown that this is something that matters. And the way to show that something matters is really about the movements and advocacy being owned by the community and being fronted by the community. So it's that notion of, mobilization, networks, power, creating demand, that kind of public narrative. What are the lived experiences, the individual perspectives, but then the community and the asks, and having unified asks and being organized as a movement and as a a civil society, and many different examples how we can do this. But I believe that Nupur, better than anyone, will tell us more about this. And I am just going to finalize with one other point here. We'll be unpacking more in a second, but on to the next slide, please. And just the NCD Alliance, through the Our Views, Our Voices initiative and through a consultative effort in really hearing voices from across the world, developed a global charter on meaningful involvement of people living with NCDs. So that everything that we have been kind of discussing around the organizational culture, the enabling environment, the seat at the table, the global charter goes into this, principles and strategies. I'm just highlighting here some of the strategies because I think they kind of speak to enabling meaningful involvement, and some of these really touch upon needing to understand what are the barriers to participation, and how, as organizations, advocates, researchers, we need to be listening, looking at those, and also breaking them down. And so some examples there, and the center is doing incredible work on this, but some examples there of creating those enabling environments for participation will include sharing resources in local languages, partnering with obviously local community-based organizations, how we can enable confidence of individuals in participating and sharing views without fear of stigma or discrimination. There's a responsibility there to be providing support to enable participation, and making sure that and thinking very carefully about who is being involved and who is being left behind, what strategies can we put in place to enable that access and participation and voice. Just bring us back to that idea of this is all about power and sharing power. So I think I'm going to leave it here, but this is the perfect, and on to the next one. And this is our perfect segue to bring in to our session today for a fireside discussion, fireside chat, if you will, the absolutely fantastic Nupur Lalvani. And it's a real pleasure, Nupur, to have you join us today. Nupur is the founder and director of the Blue Circle Diabetes Foundation. This is India's largest patient-led non-profit organization dedicated to supporting people living with all types of diabetes. With lived experience of type 1 diabetes since childhood, Nupur has transformed her personal experience into a mission of advocacy, education, and community building, which is why she is so perfect to be joining us today. She is a very well-recognized voice in health policy advocacy, with engagement with the NCD Alliance, the WHO Global Diabetes Compact, the Healthy India Alliance, the International Diabetes Federation, and others. And maybe we'll hear more about this. And Nupur will be telling us about her journey as an advocate, but she's represented the global diabetes community at places like the World Health Assembly, the UN High-Level Meeting on Universal Health Coverage, and many other multi-stakeholder forums. And she champions issues like better access to insulin, affordable technology, and integrated NCD care. And Nupur wears many hats. It's always fantastic to hear Nupur speaking from her diabetes perspective, but absolutely an NCD advocate, and someone that we've absolutely had as NCD Alliance the pleasure to be counting on as an advocate. So Nupur, a very warm welcome for joining us today. You've been you played such a critical role with the Our Views, Our Voices initiative and global NCD advocate. We absolutely see you as a champion. So could you share with us today, tell us about your journey in becoming an advocate, please?
Thank you, Christina. Thank you for that kind introduction. Hi, everyone. And thank you, Chavi and Maruf as well. It's a pleasure to be here with all of you and look forward to engaging and, uh, talking in the chat and in the Q&A as well. So like Christina mentioned, I have lived experience of type 1 diabetes. I've had it since childhood. So that was the beginning of, my journey into advocacy. And I don't know, often it's hard to put a finger on when you started, your advocacy journey, but I think safe to say that mine started, I suppose, pretty early on. I mean, I remember a few incidents when I was in school, and I was diagnosed with type 1 diabetes, and there were a few, obstacles along the way. And I think probably as early as back when I was in school is when I was advocating for myself. I just didn't know it had a fancy term, that this is what advocacy is, but realizing there's an issue and realizing you need a solution. And Christina, like you mentioned, it's not just that people are rallying around, or that there's a problem, but looking for solutions together is, what advocacy is, and it's not some sort of certificate that's handed out. If you're talking about problems and how to fix them, you're an advocate. And I think you've spoken about this, and Chavi's spoken about this. And in the Mentimeter, we noticed a lot of the comments and the words that came in. People with lived experience, know their lived realities the best. They know what they want. They may also not know what they want, and which is why building capacity of advocates and people with lived experience is also very crucial. But I think that's kind of been where I've started from, and my own experience of living with diabetes day in and day out has shaped um, my journey and the way forward as well.
Thank you, Nupur, and thank you for having, kind of shared your, for having, I think we have certainly kind of benefited from your advocacy journey and just seeing, the impact that you have had over the years. And it's always so interesting to me, this idea that your work is so grounded in the community. I'm used to seeing Nupur in places like, the World Health Assembly and different very, kind of high level side events with, government speakers. You've been at the UN and those spaces there. So could you share with us, Nupur, what role has community and, still does, what role does this community play in your advocacy work?
Right. Thank you. I think communities know, where the problems really lie, and there are problems in every system, and I think it's crucial to recognize the fact that communities identify these gaps early on, and for them to be heard and for them to have a voice, and for all of that advocacy to reach, policy level, and for there to be change to happen is the whole sort of process. But often people, and I know Ritu spoke about this earlier as well with the word empowerment, right? And I'm guilty of using this word, in another way as well. Like, we used to say early on, we empower people living with diabetes, until we realize empowerment is not something you can hand over to somebody. And it's just about helping people realize that their voices are important, their feedback is crucial, and what they say has the power to shape change for not just them, but for people like them living with the same conditions. So, I'd like to share a quick example here. We pay out of pocket. As people with diabetes, with various types of diabetes, we pay out of pocket for things like insulin or glucometers or test strips. And this is a huge financial burden on people and families, that drives families into debt. So over the last several years, we've been pushing for the inclusion of certain types of insulin and GLP-1 drugs in the essential medicine list by the WHO, and along with several other communities from around the world. We've been writing letters and sort of pushing at important key meetings for this inclusion. And in September this year, the WHO said that, well, analog insulins and GLP-1s are now part of the WHO's essential medicine list. So I think this is one way that when the community comes together, there are people that we may not have ever met in person, but it's that thread, it's that common cause that binds us, and it's also something that everyone's facing, whether they are from a high income country or a low and middle income country. There are some problems that cut across every sort of setting, but the issue doesn't end there. Now there's a lot more work to be done, because at country level now it's our job to make sure that our government adds these medicines to the national medicine list, for example. So it's things like that. I think it's crucial for groups and communities to identify a collective issue that they'd like to fix, and then work together um, to see how it can be fixed, and who are the right stakeholders to talk to. And apart from being a person with lived experience, one is also a citizen, one is also a voter, part of society, a colleague. And so it's all of these roles that come together that really have the potential to create lasting change.
Oh, Nupur, my goodness, there is so much there. That was that was so powerful. Thank you for sharing that. I thought that was it was so interesting when you were talking about, your own experience, and then that kind of power of finding the community and that collective and the shared agenda. That really kind of resonates with me. And, you were talking about, the networks, the common cause, and also, finding I was really moved when you talk about that, just, kind of in just that journey and kind of realizing your power, and just that, the power of citizenship, and that things can be changed, and that that starts with you and with us. And thank you. That was I really appreciated that. And that element of the shared agenda, I think, is something that really kind of speaks to the work that we do at NCD Alliance, and how, in looking to drive change, it is about showing that the urgency, the need, and power, and just that, the power in numbers, and finding that common shared agenda, and having that unified front. That was really, really helpful. Thank you for sharing this with us, Nupur. And could you, and this has been so interesting, seeing this over the years, and what you've brought in this space, the lived, really talking about lived experience, and the need for meaningful involvement and engagement in decision making. So could you share with us a little bit more about how lived experience is a unique and very valuable form of expertise, and how you see this, kind of contributing to research, and also to policy, please?
Thanks, Christina. I was just thinking about this while you were talking. Over the years, and we all know this, political cycles are 5 years or whatever. Institutions change their or maybe evolve, and objectives change over time. But for somebody living with HIV or diabetes or cancer or something, that's their whole life so their objectives and their goals for living happily and healthily, without financial burden, those remain constant. And I think that we know and recognize the importance of lived experience, especially in rooms like these, where I'm sure there's no one here that thinks that lived experience is not a form of expertise. It's probably the only barrier is about, how do we include lived experience? How do we, well, we talk about having a seat at the table, but before that, I think it's also very crucial to build capacity for these advocates, because often we're all from different backgrounds. Somebody could be a fisherman, somebody could be a lawyer, somebody, there could be people from different backgrounds, and still one common thing that connects them. How do we build capacity for, and I think that's something that, of course, the NCDA has been doing over the years. I've been part of the Our Views, Our Voices, Global Advisory Committee, and, scores of opportunities for people with lived experience to, sharpen their skills, understand how to write to governments, how to talk to policymakers. So I think it's really important for, not just somebody else to tell me, well, here's a place, you can sit on this table, but for me as a community member and as part of a larger collective, to decide whether this is something that I want to, be part of, or this is something that matters to, the community that I'm part of. For example, we've been doing these workshops on retinal care for people living with diabetes, because we've realized over time that, people, certain complications that are associated with living with diabetes develop over time and have maybe no symptoms, until it's too late. How do we have these conversations? And we've seen over the years, simply telling a patient a top down approach that this is what you have to do, that doesn't work, right? There are barriers. There's a lack of time, there's a lack of money, interest, knowledge. So I think, involving the community, understanding what matters to them, what makes it tick for them, is, I think, really crucial. And it's not just lived experience, is not just anecdotal data, or something good to have. It's also very valuable real world data. There are some, sometimes some glaring gaps, or something that is extremely obvious to a person that has a condition, and it may not have occurred to, other people that are on that decision making sort of table. I know that the India NCD Alliance, the Healthy India Alliance, we had a big win a few years ago, and Christina, you highlighted that in your slides as well, where lived experience has been recognized by the Ministry of Health, and by the Government of India in the national program on NCDs. And also we've seen, the social resolution, the resolution on social participation at the WHA, a few years ago. So I think, putting these into action is now, we recognize the importance. Policymakers are beginning to recognize the importance. So is everything perfect now? It still isn't. And I think, the gap perhaps now is about, putting these things into action. I was talking with a government stakeholder at an event recently, and they mentioned that, we're creating this committee on NCDs, and we've got the best doctors, and we've got people from the government. And I said, is there a person with lived experience? Is there somebody that lives with an NCD? And, he looked back at me. I know he was sincere, but he looked back at me with that kind of look that said, this is not a space for patients. So I think we still have, a long way to go, and, we still have to sort of, uh, but convey the importance of lived experience to people that are in the seats of power.
Oh, thank you, Nupur. So much there. Again, thank you for this. Yes, there is a way to go, right, on community engagement, certainly, and those having those spaces in decision making, and yes, you mentioned social participation. Want to recognize really great work that it's great to see the NIHR's Global Health Research Center having community engagement as one of its pillars of research, and something that is absolutely integral to how research is being conducted there on NCDs and environmental change, but also really kind of calling out the George Institute that is doing great work around social participation. So how we can be making the case around having, civil society, community, lived experience at that decision-making table, and how the end result is better policies, right? Because they're designed with those that they are meant to serve. As you were saying, it is going to be that lived experience that will share the closest view of what the gaps are. You mentioned something as you were talking, Nupur, that kind of triggered a thought too. There was such a beautiful word that was shared in the Mentimeter earlier, and that was also trust. And that's so interesting as well, isn't it? That if we think about the role that and I know that there's work to do, right? As you're saying, still needing to make the case on why this expertise is essential to be contributing to decision making. But I think it also really kind of, we know that it leads to a better result, but also that idea of ownership of community and building trust in the community. Because, if you want the end result to work, if that's a policy or a research result, then that kind of community ownership is so critical. I have one more question for you, Nupur, and then we would absolutely invite those that are joining us today to share any questions here. But I will share one more with you, whilst encouraging everyone to think of questions. Okay, Nupur. So just in finalizing today, could you share with us what you have seen in your experience? And obviously, you have that kind of organizational experience as well as lived experience. What have you seen as effective strategies in engaging communities?
Thanks, Cristina. I think there needs to be, sometimes there are no safe spaces for people to talk and share, and often for people living with NCDs, which are chronic and long term. If you get a cold, you go to the GP and get some meds, and you're done in a few days. But with NCDs, you're, as somebody living with an NCD, you are managing for a large part your own condition by yourself. And the lived experience of the theory of how to manage diabetes or live with cancer is so different from the practical real life experiences of should I eat a sandwich, or should I send my child for swimming for a swimming class, or whatever. And I think it's very important for people to be in a space where they feel comfortable to talk and share and ask. And this is why over the years we've attempted to create these sorts of spaces. We started out by I'm fond of running, and so I once spoke to a few people that live with diabetes and their families, and I said, do you guys want to go for a run? And that was the beginning of how things started. We gathered, and then while some of us walked or jogged or brought a pet along, we were also talking about challenges and the frustrations and all of the problems that we have in common while living with diabetes. And I think we slowly realized that it's not practical. Maybe everyone can't turn up to our city to go for the walk or the jog. There are people that don't have that cannot be in the same physical space, and so the need for online spaces came about. We have a very engaged and active Facebook community of nearly close to 20,000 people, where people talk about everything from medical issues to social problems. And of course, in South Asia we have a unique sort of mix of issues. So it's not just the disease or the condition that somebody's living with, but it's also people not being able to find a partner to get married, or having trouble with family, or getting a job, or discrimination at school or work. So there's a lot of issues that need addressing, and not everything can be solved by a healthcare professional or a medical doctor. So I think it's important to have those spaces, and then for people that are interested and involved, to be able to give them the opportunity to develop themselves as leaders, because this is not a one-man job. It takes a village, and for most of us, we're doing this voluntarily, apart from our jobs, or apart from our day-to-day lives and management of our conditions. On top of all of that, we're jumping into something that we may not have. We may not have a degree in public health, but we're essentially doing, we're engaging policymakers, we're trying to understand the system. And here's where I think it's very important that communities of researchers and communities of people with lived experience of conditions work together, because sometimes it's just two different sets of people. The data is there, there's this whole rich sort of set of stories and data and numbers and everything that researchers might need, but might not have. And for communities, we need your support. We need the support of researchers to sort of translate all of that and parse it, and maybe help put this into research. And I think that's really going to be, when we can work together, it's really going to be the thing that shifts the needle, and pushes for change. So I think, and there are smaller practical things as well, while engaging people with lived experience. For example, I've realized, so we reach out to a lot of public and private schools. We have a very robust school campaign for awareness of diabetes. In the last 4 months, across 7 districts in the state of Maharashtra, we've reached out to nearly 11,000 students and staff. Now, this requires a crazy amount of planning and logistics. And I've realized, thinking in advance. For example, if I can give a volunteer that wants to come to the school and talk about diabetes, if I can give them a travel allowance or a stipend, these things, we think these are not important, but for a student or for someone in university or someone who doesn't have a job, the very fact that their travel is compensated, or you offer to reimburse their meals, these are things that can help people grow as advocates, as leaders, if they choose to do that. And I think finally, there are a lot of, while there are the bigger problems of the world are yet to be solved, we haven't got there. We're nowhere close to UHC. It's nearly 2030. There's no world peace. There's nothing. But I think it's important to celebrate the small wins. There are a lot of opportunities for for stakeholders to work together, and there are lots of good things that are happening as well. So I think it's crucial to highlight those, and to recognize those as wins and share them with others so that they can use them as well.
Oh, thank you, Nupur. That was absolutely amazing. And you were kind of ending there on that point of the, kind of celebrating the achievements. That's such an important aspect of advocacy, isn't it? And just, kind of really kind of celebrating what we're achieving together, just as encouragement, and to continue. And it's been just a real pleasure in seeing your journey that you have shared with us. And you kind of touched upon there, I think, absolutely the key things that we want to be emphasizing in today's session, right? The role of communities in driving change, how we collectively can build power. I loved what you were saying about kind of researchers and communities. We're kind of part of, it's all part, and in civil society organizations, lived experience advocates, we're just all the different pieces of the puzzle, right? But we absolutely have to be kind of coming together. That and intrinsic to that kind of building power is that shared agenda, really kind of unifying around what it is that we're seeking to achieve. We had a question there that I think that you were addressing in your comments, Nupur, around just kind of trust and how to build trust and space for people to share their lived experiences, and I was hearing from you about really meeting people where they are at. I was hearing about the great work that you're doing with your organization. Really, you were talking about how you were kind of reaching schools and the community, and that really one-on-one work that you do. And I know that you've kind of brought this also to the Our Views, Our Voices initiative, and so much of this has been about finding and providing those safe spaces. I thought it was interesting how you were sharing with us about how there you can be creating some of those safe spaces online, but really making sure that we are creating those platforms, and I speak here with very much an organizational hat on, just just acknowledging the power of communities. And it's such a critical as from kind of the decision makers, organizations, researchers, just the power of voice and listening to those voices. I think it's been an incredibly helpful discussion that we've had over the last hour. I think that we're coming to a close now. Nupur, I don't know if you have just like a couple of minutes as we're finalizing before we go to Chavi to close.
No, I just want to say thank you for the opportunities. Opportunity has been wonderful, talking, and thank you for, all your comments. And I hope that we find ways to engage as, people with lived experience and people working in research. And just to Neha's comment and question, I think that, for somebody to open up and share about their lived experience, well, I think it's people understand, once they understand what's in it, there doesn't have to be something in it for them particularly, but if they understand the larger picture, sometimes, you tend to think, what would this person understand about my research? Or maybe it might help to share a little bit of background, or, I know for me, that is something that would work for me as a person with lived experience. If, somebody could share, well, I'm asking you this set of questions, but this really ties into, the larger, this is what I'm doing and this is what the research is about. I think that could be helpful.
Amazing. Thank you so much, Nupur. It's always a pleasure to hear from you. So thank you again, and over to Chavi, please.
Thank you. No, this was wonderful. I do have one question for both of you, because we have both of you here. Would love to hear your thoughts on when we're working with lived experience advocates. How do we balance the sort of elevating the individual stories while still capturing the diversity and complexity of the broader community that an individual might be representing? And that's something, I mean, I've always been sort of thinking about. So would love to hear your thoughts on this.
I'm happy to share some thoughts, and definitely want to hear you too, Nupur. Chavi, one thing that we found in the NCD space, and I'm speaking obviously as the NCD Alliance here, one thing that we've grappled with that question for quite some time, right? Which is just so in the NCD space, there's a whole range of conditions that people are living with, and so over the years we want to bring the power of these kind of unique, diverse voices, but the challenge of having a unified voice. So how do we allow for this? One thing that I thought was here at NCA really powerful to come across was this kind of concept of public narrative, and we use this with the Our Views, Our Voices training that we do with lived experience advocates. And basically the concept of public narrative breaks down into the story of self. So that is, an individual and, just what your lived experience is, what your experience is, the story of self, the story of us. So always thinking, you need to move from, there's a story of self, but there's also a story of us that you need to bring to the table. And the story of us is the community, and how this is an issue that, is not, you're not the only person facing this. This affects, there is a whole that this is affecting, and something that matters to a community, a collective. That's the story of us. And then there is the story of now, that kind of is the advocacy ask at the end of this. And obviously, I mean, I'm talking about an advocacy ask. It could, but basically, it answers the point, like, why now? Why is this relevant now? And that speaks to the context and a little bit of, what the window of opportunity is, why you want action to happen at that precise point in time. That was really, really helpful for us at NCD Alliance, and in a year of a global campaign where it's just, getting that balance right. It's absolutely the power of the movement is in hearing of all of these, fantastic, diverse voices, but really kind of concentrating in finding a shared agenda, and in that, the story of now, like that unified ask, because we know, particularly in the advocacy space, that decision makers aren't going to be listening to us if we're all coming with different asks, right? So just clarifying that unified ask, and then allowing for spaces for, those really kind of unique perspectives to shine through. Nupur.
Christina, in one of your previous slides, something really stood out to me, and I think it's perfect for Chavi's question. So on your slide, it said advocacy is not only strategic, but also dynamic. And I think it really depends, right? For example, I want to share this quick story of how during the Vidhan Sabha elections last year, we created a diabetes manifesto. And then we went to our local policymakers, and well, there are groups of citizens doing this for issues, with regards to the environment, or with stray dogs, or, with the AQI in some parts of the country. So why not also with health and with diabetes or NCDs in general? And so we went to a few policymakers in the city, and to one gentleman that we met, we introduced him to a young girl living with type 1 diabetes, and he was shocked. So the policymaker lived with type 2 diabetes himself, but he thought that's the only type. And so he had an opportunity to understand through, one individual story, that there are many types. It can happen to anyone. It's not a rich man's disease. It's it can happen to anybody. And then also with some others, we presented our requests and our interest in universal health coverage for people with NCDs. So then we shifted gears and spoke about something that is applicable to the community at large, not just one story or one person. But I think we have to pick and choose. The media sometimes may like a story of a young baby, a 2.5-month-old child that's got been diagnosed with neonatal diabetes, and that could lead to a discussion where we can then put forward a collective ask. So I feel like it depends, and it's good to choose depending on what works.
Thank you both. No, I think that's really helpful. And I think the simple framework, Christina, that you said, story of me, us, and now, I think can really help bring it all together. So thank you so much, Cristina and Nupur, for this very insightful session, and Nupur for sharing your personal experiences as a lived experience advocate. And what we've heard in the last hour or so is a powerful reminder that communities are not just stakeholders, they are leaders, they are knowledge holders and drivers of change. And it's not meaningful engagement. It's not a single activity or empowering. It is a commitment to shifting power, listening deeply, and creating that space for lived experience to be able to shape decisions, policies, and outcomes. So I hope that with today's conversation, it will encourage all of us to reflect with all the sincerity that of the policymaker that you met, Nupur, on how we can make our work more inclusive and community driven. I think even small shifts in how we listen and collaborate can create lasting impact. So yeah, on behalf of all of us, thank you so much to our speakers and to our audience who has joined us today, and wishing you all a wonderful rest of your day. Thank you. Bye then.
Thank you. Bye-bye.